my name's Dr. Angela Cooper and I'm a clinical psychologist. So my area of expertise is in medically unexplained symptoms or mind-body symptoms. And at the moment I'm currently working in Canada looking at a pilot project to see how effective and efficient it is when we offer psychology services, a particular form of psychological service, to patients who come to the GP surgeries with what we call medically unexplained symptoms. And the pilot project is really trying to study whether A, therapy can be effective with these patients, and B, whether doctors really benefit by having this knowledge about mind-body symptoms and actually how different an approach it requires to treat these difficulties. It's not the same as a traditional medical problem, which I will explain a little bit about. So I want to tell you a bit about why I'm incredibly passionate about this area. So the first thing to say is that this is almost an epidemic in terms of the amount of people that go to their doctors with these medically unexplained symptoms. You can think of diagnoses like IBS, migraines, headaches, chronic back pain, fibromyalgia, psoriasis, tension headaches, chronic fatigue, confusion, weakness, dizziness, GI disturbances, things like that. These would all be classed in the medically unexplained symptom category because we don't know, or at least the medical model doesn't know, what causes these particular problems. And it actually is the leading cause of outpatient medical visits, and it's estimated that between 15 to 30% of visits in primary care are due to people seeking help for these difficulties, and that actually rises to 50% in secondary care and 60% in tertiary or specialty services. Now, the thing with mind-body problems or medical unexplained symptoms is that they do not conform to a traditional medical model. And that means that there's no pathological disease process going on in the body. And when people are tested via medical investigations, there's generally nothing found. And so that causes real anxiety both for the doctor and for the patient, who can then end up believing it's something much worse than what it actually is. And they can also end up being treated via medication or potentially specialty referrals that actually aren't appropriate for that particular condition. And what we now know through a variety of disciplines, neuroscience, psychology, psychiatry, is that often mind-body symptoms are caused by a complex interaction between the brain and the body's physiology, which is attributable to emotional dysregulation. And I won't say too much about that, but essentially our body's immune system goes into overdrive if we've had emotionally difficult experiences and we don't know how to regulate our emotions. And that can trigger a process whereby our nervous system produces chemicals and hormones and can cause the symptoms themselves. So it's actually a physiological process rather than a disease process. And because of this lack of knowledge, doctors can often feel frustrated, and it can also contribute to the burnout that we see in some of our physicians, because doctors are in their job to help and fix problems, and they want to be able to do that. But with these particular disorders, it's very difficult to find a treatment that helps. And what we now know is that there are specific psychological treatments, short-term treatments, that can actually really help people with these mind-body symptoms. We have evidence that medical unexplained symptoms can actually be positively diagnosed via specific interviewing technique, and that really involves, in brief, encouraging people to talk about the emotional processes that have been going on in their lives and the memories associated with that, and by allowing them to become aware of the emotions that are driving them to get anxious or for their nervous system to become activated, we can actively begin to address the root of the problem. We're at a tipping point really where research has amassed where this now needs to become public knowledge, and I think it's a travesty that it isn't public knowledge enough, and in the way that I would like to see it is that everybody understands that the mind and body are connected and they can't be separated, and that also the other thing is that dealing with the stigma about symptoms where you don't find a physical cause is that it's not that the pain's not real or that it's just in your mind. This is actually a physiological process caused by the brain, and so it's really to bring some credibility to these people's suffering, I think, is so important, and it's the thing that really gets me excited and passionate in this particular area. Most common question when they come to see me is, can you really treat my physical symptoms via talking? And they can't really get their head around that. But within one to maybe six sessions, patients are experiencing benefit because of the particular focus that the therapy that I use can take, but also many other therapies that have a focus on the body and the emotional processes that are going on underneath. So hopefully I've inspired you a little bit to be interested in my story, and I don't know, you'll decide whether I will be of any use to presenting this information. That's the end of my presentation. Thank you.